Welcome to the Discourse Analyzer AI Toolkit, where articles come alive. You're listening to the audio version of our article. For the full text and an interactive experience, check out the link in the description below. Interact with any selection using our AI assistant to enhance your understanding. Let's explore.
Health crises in discourse analysis. Interactive assistant health crises refer to widespread and often urgent threats to public health, such as pandemics, epidemics, natural disasters, or environmental hazards that have serious implications for populations. These crises often spark intense public discourse, as governments, health institutions, the media, and the public engage in conversations about causes, prevention, management, and response. In discourse analysis, the study of health crises focuses on how language is used to shape public understanding, manage risks, frame responsibilities, and influence policy decisions. Discourse analysis examines how health crises are framed, how different actors, e.g., health authorities, politicians, media, and the public, construct narratives, and how power and knowledge are distributed through language. By analyzing news reports, government briefings, health campaigns, and social media conversations, discourse analysis reveals the linguistic patterns that reflect societal values, fears, and attitudes during health emergencies. Key features of health crises in discourse analysis. 1. Framing of the crisis. Framing refers to how health crises are presented to the public through language. Discourse analysis examines how different actors frame health crises to convey urgency, responsibility, and risk. These frames influence public understanding and determine which issues are prioritized in health policy and crisis management. Example: during the COVID-19 pandemic, government officials often framed the situation with phrases like, "We are fighting a war against an invisible enemy," using war metaphors to convey the seriousness of the crisis. Discourse analysis would explore how this framing mobilized the public, shaping the pandemic as a battle requiring collective action, while emphasizing certain strategies like lockdowns and vaccinations. 2. Risk communication and public understanding. During health crises, risk communication is essential for informing the public about potential dangers and guiding appropriate behaviors. Discourse analysis focuses on how risk is communicated, whether through formal channels like public health announcements or informal channels like social media, and how these messages affect public perceptions. Example: a public health campaign might use language like, "Washing your hands for at least 20 seconds can prevent the spread of the virus," simplifying scientific information to promote preventive action. Discourse analysis would explore how this language balances technical accuracy with accessibility, making complex health risks understandable to a broad audience. 3. Blame and responsibility. Health crises often lead to discussions about blame and responsibility, with different actors attempting to assign or deflect blame for the crisis. Discourse analysis examines how language is used to construct narratives of accountability, often reflecting broader political or ideological divides. Example: during the Ebola outbreak, media reports might have used phrases like, "The government failed to act quickly enough," assigning blame to political authorities for a delayed response. Discourse analysis would examine how this language constructs a narrative of government failure and shifts responsibility away from other factors, such as global health inequities or environmental causes. 4. The role of experts and scientific authority. In health crises, scientific experts often play a critical role in shaping public discourse by providing knowledge, making recommendations, and guiding policy decisions. Discourse analysis investigates how scientific language is used to establish authority and how expertise is communicated to the public. Example: during the COVID-19 pandemic, health officials might have said, "Based on the latest research, we recommend maintaining social distancing," invoking scientific authority to justify health policies. Discourse analysis would explore how scientific language constructs credibility and legitimacy, influencing public compliance with health recommendations. 5. Media representation and sensationalism. The media plays a significant role in shaping how health crises are understood, often using sensational language to attract attention. Discourse analysis looks at how health crises are represented in the media, focusing on the use of emotional or exaggerated language, and the impact of these representations on public perceptions and behaviors. Example: a headline like, "Deadly virus sweeps the globe, millions at risk," uses sensational language to evoke fear and urgency. Discourse analysis would investigate how this type of language influences public anxiety, potentially leading to panic or misinformation, while shaping how the crisis is understood in terms of severity and spread. 6. Stigmatization and marginalization. Health crises often lead to the stigmatization of certain groups or individuals, particularly those perceived as vectors of disease or who are disproportionately affected by the crisis. Discourse analysis examines how language contributes to stigma, discrimination, or marginalization during health emergencies. Example: during the early stages of the HIV/AIDS crisis, public discourse often used phrases like, "a gay disease," contributing to the stigmatization of the LGBTQ+ community. Discourse analysis would explore how this language reinforced harmful stereotypes and marginalized certain groups, shifting attention away from the structural causes of the health crisis. 7. Government communication and public policy. Government communication during health crises plays a crucial role in shaping public behavior and policy responses. Discourse analysis investigates how governments use language to manage public expectations, justify policy decisions, and maintain control during crises. Example: a government statement might declare, "We are implementing these restrictions to protect public health and ensure the safety of our citizens," justifying lockdown measures. Discourse analysis would examine how this language balances authority and reassurance, framing government actions as necessary and protective, while seeking to maintain public trust. Methods for analyzing health crises in discourse. 1. Critical discourse analysis, CDA. Critical discourse analysis, CDA, explores how power, ideology, and social inequalities are embedded in the language used during health crises. CDA focuses on how certain discourses dominate public conversation, marginalize alternative perspectives, and reflect broader power relations. Example: a CDA of government briefings during the COVID-19 pandemic might reveal how the language of authority and expertise was used to assert control, while marginalizing the voices of frontline workers or communities disproportionately affected by the virus. The analysis would explore how this discourse reflects and reinforces power dynamics between governments, health institutions, and the public. 2. Frame analysis. Frame analysis investigates how health crises are framed in public discourse, focusing on how certain aspects of the crisis are emphasized while others are downplayed. This method helps to uncover the underlying values and priorities that shape public and institutional responses to health emergencies. Example: in the early stages of the COVID-19 pandemic, some political leaders framed it as just another flu, downplaying its severity, while health experts framed it as a global health emergency. Frame analysis would explore how these different framings shaped public understanding of the crisis and influenced responses such as mask wearing or vaccine uptake. 3. Narrative analysis. Narrative analysis examines how stories about health crises are constructed in media, government communications, and personal accounts. This method focuses on the structure of narratives, the roles of key actors, e.g., victims, heroes, and villains, and how these stories influence public perception. Example: a narrative about healthcare workers during the COVID-19 pandemic might frame them as heroes on the front lines, using language that emphasizes sacrifice and dedication. Narrative analysis would explore how this narrative shapes public admiration for healthcare workers while potentially obscuring systemic issues such as underfunding or poor working conditions. 4. Risk communication analysis. Risk communication analysis focuses on how health risks are communicated during crises and how language is used to manage public fear, uncertainty, and behavior. This method examines the balance between technical accuracy, simplicity, and emotional appeal in crisis communication. Example: during a flu outbreak, public health messages might emphasize, "Get vaccinated to protect yourself and others," combining individual responsibility with community care. Risk communication analysis would investigate how this language motivates protective behavior by framing it as both a personal and collective responsibility. Examples of health crises in discourse analysis. Example 1. Framing of the COVID-19 pandemic. In early political discourse, Some leaders referred to COVID-19 as the China virus, framing the pandemic in nationalistic or xenophobic terms. Discourse analysis would explore how this language contributed to the stigmatization of Chinese communities and shifted blame onto a specific nation, while detracting from global cooperation and public health messaging. Example 2. Government communication during the Ebola crisis. During the Ebola crisis, government statements often emphasized containing the outbreak and preventing it from spreading beyond our borders, framing the crisis as a national security threat. Discourse analysis would examine how this language prioritized border control and security over humanitarian aid, reflecting a nationalistic approach to a global health emergency. Example 3. Media sensationalism during the swine flu outbreak. Headlines during the swine flu outbreak used phrases like, "Swine flu panic sweeps the nation," sensationalizing the situation. Discourse analysis would investigate how such language amplified public fear, potentially contributing to panic-driven behavior, while shifting focus away from preventive measures or scientific understanding. Example 4. Stigmatization during the HIV/AIDS crisis. In the early years of the HIV/AIDS crisis, public discourse often referred to it as a gay disease, stigmatizing the LGBTQ+ community. Discourse analysis would examine how this language marginalized affected populations, framed the crisis as a moral rather than a public health issue, and delayed effective responses by focusing on blame rather than prevention and treatment. Example 5. Vaccine discourse during COVID-19. Public health messaging about COVID-19 vaccines often used language like, "Vaccination is the key to ending this pandemic," framing vaccines as the ultimate solution to the crisis. Discourse analysis would explore how this narrative shaped public attitudes toward vaccination, mobilizing compliance while also generating resistance among anti-vaccine groups. Challenges in analyzing health crises through discourse. 1. Rapidly changing discourse. Health crises evolve quickly, and public discourse can shift in response to new developments, creating challenges for discourse analysts to capture real-time changes in framing, communication, and public sentiment. 2. Misinformation and conspiracy theories. During health crises, misinformation and conspiracy theories can spread rapidly, influencing public discourse in ways that complicate analysis. Discourse analysts must be able to identify and understand how these false narratives gain traction and affect public behavior. 3. Global versus local perspectives. Health crises often involve both global and local dimensions, with different actors framing the crisis according to their priorities. Discourse analysts must account for these varied perspectives and how they shape the response to the crisis across different regions and populations. Conclusion. Health crises are moments of intense public discourse, where language plays a critical role in shaping public understanding, guiding behavior, and influencing policy. Through discourse analysis, researchers can examine how health risks are communicated, how crises are framed, and how narratives of blame, responsibility, and heroism are constructed. By analyzing the language used by governments, media, health professionals, and the public, discourse analysis reveals the power dynamics, social inequalities, and cultural values embedded in crisis communication. Understanding the role of discourse in health crises is essential for improving public health responses, reducing stigma, and promoting effective communication during emergencies. Frequently asked questions. What is the focus of discourse analysis in the context of health crises? Discourse analysis in health crises examines how language constructs public understanding, assigns blame, manages risk, and influences policy decisions. It looks at how governments, media, health authorities, and the public communicate during crises and how these discourses shape behaviors and attitudes. How are health crises typically framed in discourse? Health crises can be framed using metaphors, e.g., war, disaster, emphasizing urgency, responsibility, or risk. For example, COVID-19 was often framed as a war against an invisible enemy, urging collective action. Discourse analysis studies how these frames prioritize certain responses and influence public perception. What role does media representation play in health crises? Media representation can significantly shape public understanding by using sensational or emotionally charged language. Discourse analysis investigates how headlines like "Deadly Virus Sweeps the Globe" impact public fear, and potentially lead to misinformation or panic. How does discourse analysis approach the communication of risk? Risk communication in health crises balances technical accuracy with simplicity to ensure public comprehension. Discourse analysis explores how language like, "wash hands for at least 20 seconds, is used to translate complex scientific advice into actionable public messages. What does discourse analysis reveal about blame and responsibility? Discourse analysis shows how language assigns blame during health crises, reflecting political or ideological divides. For instance, phrases like, "government failed to act promptly," place responsibility on political entities, influencing public trust and accountability. How do health crises lead to stigmatization, and what does discourse analysis reveal? Certain groups may be stigmatized as vectors of disease. For example, early discourse on HIV/AIDS labeled it a gay disease, marginalizing LGBTQ+ communities. Discourse analysis examines how such language perpetuates stigma and shifts focus from structural solutions to blaming individuals or groups. What methods are used in analyzing health crisis discourse? Critical discourse analysis, CDA, focuses on how power and social inequalities are reflected in crisis language. Frame analysis studies how issues are highlighted or minimized to shape public understanding. Narrative analysis looks at the stories constructed around health crises to understand public perception. Risk communication analysis examines how risks are conveyed and the effectiveness of the language used. How is scientific authority presented in health crisis discourse? Scientific language is often used to establish authority, with phrases like, "research indicates that," lending credibility to public health recommendations. Discourse analysis explores how such language helps or hinders public compliance and trust in experts. Can discourse analysis show how governments communicate during health crises? Yes, discourse analysis studies how governments use language to justify policy, maintain control, and reassure the public. For instance, statements like, "these measures are for public safety," are analyzed for their impact on public trust and compliance. What are the challenges in analyzing health crises through discourse? Challenges include tracking rapidly changing discourses, navigating misinformation, and balancing global versus local perspectives. Analysts must consider the evolving nature of language in response to new developments and regional differences in framing and communication.